Making an India hub for foreigners when it comes to it being a medical hub. Will hospital sector really attract capital going forward? To answer all these questions, Dr. Devi Shetty from Narayana, Hrudayalaya, as well as Kiran Mazumdar Shaw, Executive Chairperson at Biocon, joining us on the show right now. Dr. Shetty, morning. If I could begin the discussion with you, what do you think about medical infrastructure in India? And do you really think over the next 10 years, if the focus is done via Atmanirbhar revival mission, medical infrastructure can be one space that can attract investments and create employment for the country?
Today, if somebody needs to go for a major cardiac intervention, not more than maybe 20% of the country's population can afford to go through it, or they have the access to it. More than the affordability, it's access. So the important issue, what is facing in India, is the creation of infrastructure. That itself is not there, mainly because of multiple reasons. One is shortage of medical specialists, shortage of infrastructure to do the procedures. So there is a great demand for a country like ours to invest on the infrastructure. We need to do about 60 million surgeries of all kinds a year. Today, only about 26 million surgeries are done. We need to double or triple the number of interventions on the human body, leave alone heart. So that requires a massive investment and massive infrastructure. Great opportunity.
Do you think medical infra, will also support a lot of tourism, from foreign tourism for medical infrastructure? India is already a strong destination, but can we see it grow multifold during this time?
Now discussing about the survival, forget about the growth. We are worried about ourselves. We are not sure how the future is going to be. So essentially, there has to be a major different look at the healthcare, any industry, especially healthcare industry, to ensure that the hospitals don't close down. If the same situation continues for another 2-3 months, believe me, half the hospitals in the country will close down. They won't have money to pay the salaries of the doctors and nurses. It's a very bad situation right now. Okay, that is that apart. So essentially, unless the government changes their outlook towards healthcare, nothing is going to happen. Now, we know that the government doesn't have that kind of money to throw at the healthcare industry. There are many priorities. If government really wants to do few things, one thing is next 5 years, government shouldn't look at healthcare industry as an industry which can give them the money. They should not look at healthcare industry as a revenue generation industry for the government. That is one thing they have to do. For 5 years. In 5 years, I'm sure we will be able to manage ourselves. The second thing is, most important thing, liberate nursing, medical, paramedical education. If these two things, if the government does, there will be a dramatic transformation.
Kiran, what's the sort of policy support you think is going to be needed for the same? And do you think perhaps, on investment, certain incentives, tax ops, that's perhaps what could possibly be looked at?
The healthcare sector is India's next IT sector. I really believe that this is the potential we have in the healthcare sector. It is already a $100 billion sector. We can actually make it almost a 5-fold sector if we want to over the next 10 years, provided we really invest in this sector. Right now, let me also talk about one more thing which I really want to engage with at least the government's imagination on. Today, if you look at the drug industry, the pharmaceutical industry, we are already the pharmacy of the world. And if you think about the fact that 60% of vaccines that are produced for the world come from India, Why are we not really thinking about vaccine diplomacy for the world? I mean, today, at a time when everyone is really just waiting for a vaccine to arrive, and where the large part of the developing world, where the most of the people live, will all need vaccines, India can actually be the savior of this part of the world. In fact, India can be the savior of the world if we really put our vaccine diplomacy at work. So I, for one, believe we must invest in this sector. We don't have enough faith in our own capabilities. We don't provide enough opportunities for our own healthcare professionals, our scientists, our researchers. And what we are doing is we are almost encouraging them to leave the shores of India because the opportunities in other parts of the world are so attractive. Why can't we create those opportunities in India? Why can't we have, a real focus on research, innovation? We've been talking about all the innovation that goes on in biomedical, in the whole biomedical area, whether it is in the pharmaceutical and biopharmaceutical area, whether it is in medical devices. Look at the way we've actually been very resilient in terms of developing our own test kits and so on and so forth. Look at the way the whole healthcare sector has come around in terms of providing the basic healthcare for the COVID patients. And look at the way the Indian healthcare sector has actually dealt with both infectious and non-communicable diseases at scale. I think we have such a lot of capabilities, resources, investments, and talent, and we don't know how to leverage it at a global scale. So I, for one, believe that policies have to be what they did for IT. For instance, the IT got a large number of tax breaks so that they could invest in this sector. We are at that Y2K inflection point with COVID, and we need to reinvent this whole healthcare sector through things like, digital architecture, telemedicine, e-pharmacies, and a whole lot of regulatory, platforms that are electronically enabled. We can do a lot of things if we want to.
Right. But Kiran, when we talk about prices or when we talk about affordability, as size grows, don't you think efficiency and affordability will also come in next?
I think it's a myth and an absolute misinformation to say that there is no affordability in our system. We are the lowest cost healthcare system in the world. And I think Dr. Devi Shetty will bear me out in this. We are the lowest cost producer of drugs and medical devices and test kits and what have you. You name it and we are the lowest cost. But media and the public at large has been made to believe that we are profiteering, that, we are not affordable. This is ridiculous. I think we have the most affordable healthcare model in the world. And I think we should learn to respect that model, leverage that model, and don't expect that private sector has to be, functioning at below cost. That's what you want us to do, which is not possible. Government has to invest in healthcare. Government has to bear the cost of healthcare. You cannot expect the private sector to bear the cost of universal healthcare for a country as large as India. That is my view.
Right. Dr. Shetty, if I could get you in here, what are the operational difficulties that you see if high growth is indeed needed for the sector? Do you think more skill, more training will be needed before any sort of implementation?
First thing is, healthcare industry is the world's largest industry at $8.2 trillion. It is going to be the driver of the global economy and the largest employment generator across the world. Now, what are our handicaps? Let's look at the strength of our country. 3 months ago, when COVID came, there are 3 manufacturers of PPE. We are struggling with PPE. Today, we are thinking about exporting PPE across the world. We can create more than 1 million pieces of PPE every day. We hardly had 30,000, 40,000 ventilators. Today, we have capacity to make thousands of ventilators every day. So this is an amazing country. It just needs right kind of policies. I'll give you one example of how policies can make a difference. 17 years ago, the Indian Space Research Organization helped us to launch one of the world's first telemedicine programs in our hospital in Bangalore. 17 years ago, people never heard of the internet. Internet wasn't born. And I was sitting in this chair, seeing patients in Tripura, Agartala, and all over the place in Africa, right? And 17 years, it was illegal. Government funded the program, but it was illegal. Only 1 month ago, 1.5 months ago, it was legalized. Today, doctors like us, like me, are seeing more patients online than offline sitting in front of us. Why it couldn't have been done earlier? Anyway, that's besides the point. All I am trying to say is that this is a country which just waiting to explode and conquer the world. But we need the right policies. We are running a hospital in Cayman Island, and the entire Caribbean region wants us to run their hospital. Now, to run the hospital, I need doctors, nurses, medical technicians. When I'm struggling to have doctors to manage my own hospital in Bangalore, how am I going to send doctors to Caribbean region? So we have an opportunity to be the caregivers for the world and earn over $100 billion a year of foreign currency every year just by training 5 million doctors, nurses, and medical technicians. And when we open the market, look at the market it is going to create. Then when we are running the hospital, obviously we'll be preferring all the Indian-made drugs. That's what we are doing in Cayman Island. Look at the market we create for the medicines. Look at the market we create for all the equipments. This is going to be the Indian century, provided our policymakers look at it as an industry of the future. And this is 1,000 times bigger than software industry. Software industry is only $3.4 trillion. And IT healthcare industry is now more than $8.4 trillion. So it's a massive industry, but without policy changes, without government support, it cannot happen.
Kiran, now we've already seen Fortis, for instance, be acquired by global players. PE investment in the hospital sector, do you think diagnostics, healthcare will attract a lot of FDI, FPI going forward?
Remember that most of the investment in India has come into the pharmaceutical sector. I don't think we've seen the kind of investment taking place in, the medical device sector or even in the diagnostic sector to that extent, okay? Yes, diagnostic labs, some of them have gone public and there have been investments in those labs. But even that hasn't grown to the scale that it ought to. Because I think we have not created a very optimal ecosystem for the healthcare model. I think out of pay is still too high for a country like India. We still have, almost 70% out of pay, which is very, very high for a country like India. So neither our healthcare insurance models have been optimal because people can't afford very high insurance premium. India has not been able to come out with a great universal healthcare, scheme or a product for the whole country. I'm glad Ayushman Bharat has come out now for the lower income population. I think it needs to extend beyond that. And I think once you cover a large part of the population with a universal healthcare system, with reduced copay for any kind of treatment or medication, then I think you will see that this is a sector that's going to be invested in very heavily. Because otherwise, I think you're going to always be strapped in terms of expanding, whether it's diagnostics, whether it's medical devices, whether it's hospitals. Once you create the demand and the supply and get that balance right, I think you will see the hospital sector become much healthier. Like one of the things that really worries us today is that you don't have enough hospital infrastructure in rural India. I think that is a big, big deficit that is going to hurt us in the short term.
All right, Kiran, Dr. Shetty, thank you so much, both of you, for joining us today for that interesting conversation on what to expect going forward. Very dynamic space at the moment. We leave it there. Thanks so much for watching. Lots more coming up. Do stay tuned.